Welcome and thank you to everyone for tuning into this Public Health Modernization Town Hall. I'm Commissioner Kelly Minty Morris. I'm the board chair in Klamath County, and I also serve as the co-chair of the Health and Human Services work for the Association of Oregon Counties. I serve with Commissioner Myron from Multnomah County, and Commissioner Fisher from Clackamas County serves as our vice chair. Additionally, I have the great honor of hosting you here today with my friend and colleague, County Commissioner Claire Hall in Lincoln County, a longtime advocate for public health. During this Zoom town hall, we will have a great mix of Oregon legislators, local public health officials, and county commissioners to talk about our public health system and how modernization advances all of our ability to promote health, eliminate disparities, and respond to the changing threats in health. We've also invited community partners to share their partnership with local public health departments. Now, a little bit of background. I know many of you probably know all this and could recite this better than I can, but there are 33 local public health departments in Oregon covering 35 of the 36 counties, and each of those are overseen by their own governing body called the Local Public Health Authority. Usually that's a board of commissioners. Public health departments, however, oversee the variety of programs, including environmental health, managing communicable disease prevention and outbreak response activities, maternal and child health programs, reproductive health, immunizations, and WIC. And of course, we all know now that local public health departments have taken on the critical role in managing this COVID-19 pandemic. All our community care, they do case investigation, contact tracing, and wraparound services. And I will say that probably since March, almost every day I've said some version of thank God for public health. Or maybe on really challenging days, oh, poor public health. And just a quick little shout out in case any of my people are on, my public health department is filled with sort of the rock stars of all rock stars. So thank you to them. Today, however, we're going to really focus on the future of public health through the lens of public health modernization, which was passed into law in 2015. Now, we also do need to note that while public health departments have managed this huge effort in handling this pandemic, the work would have been much more difficult without the progress that we've already made in public health modernization. However, we can also sort of recognize on the flip side that support for public health modernization prior to COVID probably would have meant that we were more prepared. So with all that, let me turn it over to my friend and colleague, Commissioner Hall, and she'll kick off our presentations.
Well, thank you very much, Commissioner Minty Morris. And it is wonderful to see the great turnout today of commissioners, legislators, and public health professionals. And I've got to admit to having had a slightly wistful thought, would the turnout be nearly as large had this taken place in January of 2020? It's been an awful year in so many ways, but if this pandemic has taught us anything, I think it's the true value of public health, that it touches every aspect of our society. I am a former president of AOC, also a former chair of the Health and Human Services Committee. And so first, I want to go through the agenda with you quickly. After this welcome and overview, we're going to hear a bit about the history of public health modernization in Oregon, hear some stories about public health partnerships from communities, what the public health agenda will be for this upcoming session of the legislature. And then, as already mentioned, we'll be concluding with a question and answer session. A few housekeeping notes. Chat has been disabled for the presentations, but there will be, so everybody's on mute. And again, please, if you haven't already done so, if you can rename yourself, also identify your organization, speaker mode, the chat's enabled to contact the host only. After the presentations, questions will be managed through the chat box, and it's important that you identify yourself as you type your question, and that's because, strictly in the interest of time, legislators and county commissioners will be given first priority, And once again, we want to ask everyone to please hold questions and comments until the presentations are complete. With that, I want to now prepare to turn it over to our first speakers to give some background and history of public health modernization and some examples of the work that's been done through the years. And Muriel, my gosh, it seems like ages since I've seen you, and apologies in advance if I mangle your last name a little bit, but Muriel de la Vergne Brown, local public health administrator in Crook County, certainly a longtime champion of public health modernization. And joining Muriel is Jocelyn Warren, public health administrator in Lane County and the current chair of CLHO, the Coalition of Local Health Officials. We're going to hand it over to Muriel to give us some of the background on public health modernization and what led us to today's discussion.
Thank you very much. And I want to welcome everyone who's on the call today. This is exciting, having this number of people and being able to talk about the work we're doing in public health. So sometimes when you hear public health modernization, what does that mean? It has been a long journey. This really ensures that public health protections are in place for every person. That was really the goal, that our system is prepared. We have the right resources to address emerging threats, which we obviously are in the middle of that right now, and that our health system is really engaged daily to eliminate health disparities in our communities. So what we really did is there was research done, and we really adopted a framework that was created by the Institute of Medicine, and then that was put into statute. So the modernization itself, if you think about why public health modernization, we had a lot of discussions back in those years. I think when some of this started, I was actually chair of CLHO. I spent a lot of time in Salem. So our funding is really siloed by program and had been. Federal agencies allocate those funds, but it really creates challenges because those are really in those siloed areas. We really needed to develop systems to work seamlessly across county borders. And we think about that as cross-jurisdictional sharing, and that has worked very well. We ensure all in Oregon are protected by a public health system. And also Oregon's plan was to really do a phase-in implementation. So the model by 2023, and we're really still far short of that for numerous reasons. So next slide, please. So the history of modernization in 2013, thank you to Representative Greenlick. He introduced House Bill 2348. That created a task force. And so the task force, Charlie Fountain from Benton County, I know Commissioner Bainey at the time from Deschutes County was on that. And that group, many of us testified to that group. That group really talked about what does public health look like in Oregon and how do we move forward. So the report was released September of 2014. And then in 2015, House Bill 3100 passed. That really created the framework for what we're doing. So it was a modern system with the goal of implementation of that model in 10 years. The emphasis was on achieving health outcomes, and there was a $500,000 investment to really assess what the current system was. What we found out is every one of the health departments did a gap analysis that was huge. I remember putting that data in, and it really showed that over a biennium, we were short $210 million to be a really current system and future system. Next slide, please. Oop. Go back one. So what we've done is I'm actually I'm a member of the Public Health Advisory Board in Oregon, and we have an accountability metrics group. So part of what we wanted to do was when we moved forward with modernization, we really wanted to create what are the metrics we want to measure? What are the things we want to look at? I will tell you those discussions were long and lots of data. So a couple things just as examples, they're in the areas of communicable disease control, prevention and health promotion, environmental health, and access to clinical services. So things we think about are like 2-year-old immunization rates, % of adults who smoke cigarettes, I think we really looked at what are the types of things that we want to measure to show the kind of work we're doing in public health. Okay, next slide. So the phases for public health modernization, we had hoped that by 2023, we would be to phase 4. We're really between phase 1 and 2. So when you think about what public health is, even with everything happening, the foundational programs are really communicable disease control, environmental health, prevention, health promotion, access to clinical services, and then ongoing evaluation and quality improvement. And then under those, we have what's called the foundational capabilities. So it's our leadership, our health equity, community partnership development, policy and planning, communications, emergency preparedness, which we're right in the middle of that, obviously, every day now, and assessment epidemiology. Okay, next slide. So I think what we're doing, thinking about moving forward, is past legislative investments have supported the public health system's response to COVID-19. We have learned a lot from this. And what we really know from all the work we've done with this is that there's got to be investment in this work we do to protect organs. And one of the things we've really learned from COVID is the importance of public health tribes and our community-based organizations working together. We are essential partners, and that is what's happening right now with COVID, how we work with our community-based partners to really look at the goal of eliminating health disparities in Oregon. And now I would like to introduce Jocelyn Warren from Lane County, and she will talk a little bit about some of the programs that we've done.
Thank you, Mariel. Thank you very much. I'm really happy to be here. I joined Lane County Public Health in 2015, just as House Bill 3100 has been passed. So I have been, as a health administrator, doing a modernization since the beginning, which has been really exciting. And one of the reasons I really wanted to join local public health was this ability to bring public health into the 21st century. And that's been a very exciting journey. I was asked to speak a little bit about what this might look like on the ground in an actual health department. What have we done as an example in the field? So one thing, what we used our funding for initially was epidemiology. And I think that word just flows off the tongue of so many people now that we're into COVID, but it was not something that was really well understood, I think, before the pandemic. But it is the foundation public health science on which we base all of our efforts and do our quality improvement. And we rely very much on the data. But until modernization, we did not have an infectious disease epidemiologist. So that's been a huge improvement in our local response. And of course, has made a giant difference in the way that we are approaching COVID-19 now with our community partners. We're able to use Tableau and make regular data reports. It allows people in our community to learn more about particular aspects of our response in the pandemic that they're interested in. And I know that's been really appreciated here locally. Before the pandemic, we were working closely with our medical partners on vaccination improvement. So that was a regional approach that we took with Lynn, Benton, and Lincoln counties to work with these evidence-based programs to improve vaccination rates across 2-year-olds and adult immunizations. So that work also laid the foundation for what we'll be needing to do now with vaccination. We did a lot around vaccine hesitancy with some of the community groups. So that's, and worked with a lot of our providers and how to have those conversations about vaccination in order to help people understand and get their questions answered from a real non-judgmental perspective. So that work also has been really important now with COVID. And finally, I just want to mention that the modernization funding, the other really important piece for us that was extremely helpful was funding allowed us to actually spend a lot more time in our communities, doing that partnership development, engaging communities, trying to understand what the local needs are. Lane County, as I'm sure many of you are familiar with, is is really large. It's the size of Connecticut, and there are many smaller jurisdictions within the county, and it's very easy to get kind of centered in the Eugene Springfield area, but we have Junction City, and we have Florence on the coast, and we have Cottage Grove and Oak Ridge in the mountains. And so it's really important to be able to really get out into those communities and understand what those local concerns are. As much as for Oregon, it's important to get out of the Portland area and better understand what's happening throughout the state. And often the best solutions for local problems are those that are generated by the people that are living here. So we need to better understand what those are. So with that funding, we were able to actually hire people that are considered our coordinators for the field, that are able to go and participate in the community meetings and talk to people and bring that information to our discussions when we're doing program planning, and to also ask them to engage in developing materials. And that's been really important with vaccination and with COVID testing. Those early relationships that we were able to build with modernization meant that we could go to particular communities, say in Cottage Grove with the mom speaking population and Latinx communities, to be able to partner with them to offer testing events and to also ask them about what their concerns are about, for example, COVID vaccination, so that when we're developing our materials, we can keep in mind those issues and take those back to them and say, do these answer your questions? Does this feel like the kind of information that the community is looking for? What more can we do? And who else should we involve? There are some very powerful partners locally who are able to be able to speak much more effectively than we can with these organizations, because they have the very long-standing relationships with those people in the communities. They're trusted, and if there are people who don't trust the government, it's not only us that are speaking to these problems. So that has been a singularly really important aspect of our COVID vaccination. And I just want to say that I really appreciate that. I think the modernization investment did really set us up much better for the COVID response. Had we not had those investments and not been able to develop both our data as well as our relationships with healthcare providers and our relationships with our community, and also this regional approach that allowed us to pool our resources and share information across counties, we would be in a much different position right now with the COVID response. So I really appreciate what we've been able to do so far, and I know that we can do so much more going forward too. And I'm really excited to see, especially being able to advance environmental health and prevention. I have to say, when we first began this journey and I was new coming on, I was thinking like, why aren't we starting in prevention? Like, that's really the heart of public health. And I wasn't convinced that starting in communicable disease was a great idea. And I 110% now am very, very happy that we started in communicable disease. So that was a great foresight there. Thank you very much for thinking of that. That I really appreciate the insights there, and look forward to working with everybody in the future. Thank you for that.
All right, thank you so much, both Muriel and Jocelyn. Next, we're going to move on to some stories from the field to demonstrate the necessity of public health working with community partners in a way that drives outcomes. First, we get to talk to Dr. Stuart Deckard. He's a hometown boy here in Klamath. He's also a family physician. He loves public health. I love this guy. He works with the Oregon Academy of Family Physicians and the Sky Lakes Wellness Center, and of course, local public health, to improve the health of our community in the broadest sense possible. He truly believes community development, social norms, and systematic change to our healthcare system are the only equitable solutions to the growing crisis of preventable chronic disease. He's currently pursuing a master's in public health. He's the president-elect of the Oregon Academy of Family Medicine and serves as the medical director of Sky Lakes Wellness Center. Now, before I hand it over to my friend, Dr. Deckard, Susan, you are on deck. Are you ready to go? Go ahead and unmute yourself and say so.
I am. Thank you.
Excellent. Thank you, Susan. All right. Oh, and one quick side note just for fun. Dr. Deckard also was willing to be one of a handful of physicians as the surge started of COVID to work on a series of videos for me. And I'm not kidding, this guy could like be in Hollywood. He translates very well to the camera. So it is my great pleasure to turn it over to Dr. Decker. You have the floor.
Hi, so I think I've unmuted myself. Can people hear me okay?
Yep.
Great. So I had the pleasure of working with our public health department largely in 2019, focusing on HPV vaccination rates. So HPV, of course, is that virus that causes the majority of cervical cancers. And as we heard, we started focusing on communicable diseases as our first target. I have lived in Klamath Falls for about 7 years, and I'm good friends with the director of the public health department, and a lot of people within the Healthy Klamath community. But this really felt like a big step forward in ability to integrate with that group to really try to get some kind of hand-holding and guidance and ideas kind of going back and forth between the providers providing individualized care to their patients in the clinic, and then the public health community trying to get the word out and good ideas about HPV out into the community. We focused on You Are the Key training. So I have the slide up, which is just some of the slide deck that we used for our Train the Trainer idea. So we went to every clinic in town, and we did a Train the Trainer exercise where we took all of the providers, but also all of the rooming staff and the front desk staff, and had this great idea of training people how to talk about the HPV vaccine, how to talk about HPV infections, how to bundle the recommendations. So that's the real big takeaway from this training, was the bundling of recommendations, which you can see on the next slide. We had a lot of really great feedback from the providers, from the rooming staff, who felt that they were now part of a system to help teach people about immunization, about HPV vaccination. I think one of the real cherries on the top of this interaction was the back and forth between our two experiences, trying to find new ways that we could improve the health system in Klamath Falls. So from my experience working with Epic, our electronic health record, I brought the idea of changing our well-person templates and changing some of the automatic reminders within the electronic health record system to prompt our rooming staff and providers to start discussing these things. So that's one thing that hadn't really come up in the public health side, because they don't have to work with these electronic health records as much. And just the kind of two experiences going back and forth was really compounding and beautiful. That was my experience. I found that even though I had existing relationships with the public health director and the public health department, working within the realm of modernization, within this kind of big overall umbrella, really gave us some structure, of course, gave us some funding, which was influential, but really brought us together in a way that we hadn't experienced before, and led to a lot of new innovations and new ideas, just kind of building back and forth on our experiences to come up with new ways to reach our community. So I'll leave you, the last slide that I brought in was just the last slide of our Train the Trainer. The fact that you are the key, I think that's really true for HPV vaccination, but it's also true for public health modernization as a whole. We are the key. We're the key to connecting regular medicine or healthcare, sick care, with preventive medicine and public health, trying to keep chronic diseases from happening before we have to start treating them in clinic and in the hospital.
Commissioner Hall? All right, I'll jump in and transition us. Perhaps Commissioner Hall's microphone.
No, I'm here. I was so spellbound by Dr. Decker, I wasn't paying attention to the script. My apologies. Thank you, Dr. Decker. And now we're going to be hearing from Susan Fisher Mackey, Director of Community Benefit Initiatives at All Care, one of Oregon's coordinated care organizations. Susan joined the All Care Health Team in 2014. Before that, she worked for over a decade in direct service roles in education and social services, where she supported the health and stability of children and families in Southern Oregon. As the Director of Community Benefit Initiatives at All Care, she draws on the strength of the relationships and insights built through those experiences to help guide the organization's engagement with and support of community stakeholders. Now, before Susan begins, Donna, you are on deck, and Donna, please unmute yourself and let us know if you're ready to go after Susan.
I am ready to go. Thank you.
Wonderful. Okay, Susan, the floor is yours.
Well, thank you so much, Commissioner Hall, and good morning, everyone. I so appreciate this opportunity to share about All Care's nearly 20 years of history of engaging in public-private partnerships with the public health departments of our service area. And those include the public health departments in Jackson, Josephine, Curry, and Southern Douglas counties. So as a CCO, we strive each day to provide quality health care in Southern Oregon. And I think it's unique that we're 100% locally owned and operated. So we don't just work here, we live here, and we're deeply invested in the well-being and the economies of our communities. And that's what makes us who we are. And it's also why we recognize the work of our public health departments as a vital component of our provider network. Time and again, we've seen that support of these public health departments programs, which truly are, as the title of this town hall indicate, people-powered, leads to higher quality, locally responsive, culturally and linguistically appropriate services being available to residents that need them in the moments that they need them most. Some examples of how we've been able to support our local public health departments include funding to ensure the continuity of clinical positions for WIC, immunizations, and reproductive health services in Josephine County. We've had the opportunity to collaborate in a way that's helped promote county-led smoking cessation programs, while also ensuring that our own internal smoking cessation programs were working in alignment with the county's efforts. We've been able to contribute our time and talents from our communication and language access teams to support community awareness campaigns on reproductive health. The image that's on the slide you see right now even shows how we've been doing this in the midst of the COVID-19 pandemic. And then we are also just so proud of a partnership with Jackson County Public Health and their needle exchange program, which has worked so hard over the years to build trust within the community. And we believe that that's reaping big benefits in this time where the behavioral health needs of our communities are becoming more and more acute. Next slide, please. So All Care's relationships that we've built over the years with public health leaders and their staff really greatly increased our ability to support them as they've worked tirelessly to address the ongoing COVID-19 pandemic, as well as the wildfires that ravaged so many parts of our shared service areas earlier this fall. And as a CCO, we deployed 2 of our medical directors to serve as a part of the public health department's response teams. And that really increased the qualified clinical oversight available to assist with COVID-19 response. Again, our communication and language access teams have supported the development of clear and meaningful messages in both English and Spanish for public health departments to get out there in ways that were distributed through diverse channels to reach as many members of our communities as possible. And when our Josephine County Public Health Director, Mike Weber, shared a need to increase outreach to community members with limited English proficiency, we were so happy to be able to support their recruitment and retention of a team of 10 bilingual contact tracers. Finally, when wildfires swept through Jackson and Josephine counties, our staff spent countless hours working side by side with public health department team members to distribute tangible goods, provide interpretation services, and connect residents to the resources they needed to stabilize and begin the process of rebuilding their lives. And it was because of our public health departments that we knew how to connect and how to contribute to be a part of the solution. Last slide, please. As I close, I really want to leave you with a clear message that All Care is committed to continuing our support of our public health departments. And we really look to other CCOs in our state to also contribute similar supports. Public health departments are key to having an integrated network of clinical professionals, as you know, with the ability to deliver healthcare at the right time and the right place while controlling costs for both patients and taxpayers. As I've been speaking with you, I'm in my home in Josephine County. And here we have one of the lowest tax bases in our state, and over 40% of our county's residents are members of our Medicaid plan. And it's important to honestly talk together and address that our public health departments are underfunded and additional resources are needed to build their infrastructure and capabilities that have been so beautifully pulled together in this modernization framework. Moving forward, we will continue to work to leverage the goals and strategies of the community health improvement plans of our service area to raise awareness about public health's role in moving health and safety outcomes forward, and to advocate for additional financial, in-kind, and policy support for these departments. We'll also continue to engage with our public health department leaders and their staff at our community advisory council meetings and other convenings where together we will make progress on mobilizing practices that recognize, rectify, and reconcile historical and current health inequities for people of color, Indigenous peoples, and others experiencing health disparities. And we will really continue to lift up the way that investments in public health hold promise for our state's continued progress to create sustainable funding mechanisms for social determinants of health and health equity. So on behalf of the All Care team, I just want to thank you again for the opportunity to be a part of today's town hall. We really look forward to continued sharing and learning alongside all of you on behalf of our state.
Thank you, Susan, and thank you for pointing out the hardships for many smaller and not as well-funded counties. I can definitely relate. Next, we'll be hearing from Donna Mills, the Executive Director of the Central Oregon Health Council. Donna arrived at the COHC in 2015 with a background in finance and community collaboration, giving her a solid foundation as a neutral convener of competitors in the local healthcare system. She's a thought leader in healthcare transformation and advocates for wellness of the entire person, bringing attention to not only the importance of physical and mental health, but also social determinants of health like housing, transportation, and education. Before I turn it over to Donna, though, is Brigitta around? You are on deck. If you could unmute yourself and let us know that you're here.
I am here. Yes.
Excellent. Thank you so much. All right, Donna, you have the floor.
Thank you so much, Commissioner. And I do want to say that I want to adopt that process of asking the next speaker if they could actually acknowledge that they were ready and so forth. I might just borrow that. Thank you so much, and good morning to everybody. I'm really happy to be here. The Central Oregon area, as probably most people know, is Deschutes, Crook, and Jefferson County. The Health Council is the governing body over our CCO, which is Pacific Source here in the Central Oregon region. And we are just delighted today to share the crucial relationship that we have with public health. I can attest to Muriel and I have traveled nationally and shared our program and had participated in some grant funding that was sent our way for being a unique model and how we might be able to spread that nationwide. We are often asked why the Health Council model is so successful, and it really is so dependent on relationship. And as probably most folks I would attest to, is that, trust moves at the speed of relationship. And if we don't have that, especially and to my previous presenters in some of those smaller, more relationship based territories and regions, if we don't have that, we're probably not going to be very successful because we don't know our population. So we really try to strive to look at relationship first and resources second, if you will. So when I say by relationship, I don't mean just having a relationship, a one-on-one relationship, but a relationship that requires a collaboration that is backed up by some type of resource. And what the Health Council brings to bear is a financial resource. And we recognize that we need all the players, all the sectors at the table to be able to better our health outcomes in our region, to elevate everybody's quality of life, and hopefully speak to those disparities as well. We also ask the Public Health Department to be at every table that we're at, because we feel that that partnership is so crucial, that some of the health outcomes that we try to seek would not be possible without public health. And when we bring all those multi-sectors together, the business community, the healthcare, 2 words, community, and public health, you really have a recipe for success in attacking some of those items that we face every day in our community. I remember being at the table early on for public health modernization. It's something that I fully support and agree with. The framework is amazing, and I have to say that we have taken time to borrow upon that framework as well. In 2019, we actually had a great opportunity to align with our public health departments, with our community mental health programs, with our hospital system, and was able to bring our regional health improvement plan together as a region, instead of it just being something that the Health Council kind of went out and authored with the community. We were actually able to leverage all of those sectors and bring that to bear. And again, without public health, we would not even get close to meeting some of the metrics we need to meet. And to Susan's point, some of those metrics that are brought to us from the Oregon Health Authority through our quality incentive measures, we actually went a step further in the last 2 years and actually took funding that we received due to the QIM outcomes and actually shared that with public health, because we felt that without them, we would not have been so successful. So I think that that is just evidence of actually doing what we say we're going to do. I think that the public health, alongside those other 250 volunteers that suit up and show up at community meetings that we hold to bring ideas and innovation into the community, is key. Our perinatal care continuum program that began the first year that I arrived about 5 years ago, our board has continued to fund that program over the last 5 years. It has been so extremely successful that we see that OHA has actually taken a derivative of that and actually has that as a covered benefit. And the program has truly paid for itself. And to me, you just don't get better than that, right? If you have patient care that is excellent and you're bringing that to bear, as well as you're saving money within the healthcare system so that we can care for more people, to me, that's a win-win situation. So just a couple of things that I had written down around a diabetes prevention program, naloxone grants, tobacco cessation. Again, if we didn't have our public health partners aligned with us to get these things done, we wouldn't be able to. And I do think that public health, maybe in the old days, or maybe some folks have been now convinced that they aren't just about prevention. And when COVID hit and people were like, oh my gosh, look what public health is doing. It was, for this old lady, I was able to say, do you know why public health was actually created in the first place? So I do appreciate so much my relationship with our 3 county health directors and their amazing staff and the amazing work and amount of work that they are able to get done. Is phenomenal. So with that, I will just thank you again for having me. I'm always happy to brag on public health, and just wish you a great day.
Thank you very much, Donna, for a great report, a great presentation. And now I get to introduce Brigitta Olsen, former COO at Dev Northwest, which is a community development organization based in Benton County, where she served for 17 years. During her time at Dev Northwest, she worked closely with the Benton County Health Department to develop a health community lens and to work upstream to help low-income communities have opportunities for health and accessible care. But before I hand it off, Pat, you are on deck, and if you could unmute and just confirm that you're ready to go after Brigitta.
This is Eva. I haven't seen Pat pop in, and I had told him that if something came up for him at work, I would be able to pinch hit for him. So if he doesn't pop in the next few minutes, I'll pinch hit.
Okay, great. Thank you very much. Brigitta, the floor is yours.
Thank you so much. So I'm a public health wannabe. I've been able to hang out with public health folks for most of my career at Dev Northwest. We started really early in my career working together by watching a video called Unnatural Causes. And we were able to learn about the root causes of public health, the social determinants of health, and why place matters. The health department, Benton County Health Department, is phenomenal. We've been on speed dial since the beginning of time. And together with many community partners and organizations, they were able to help start the Lynn-Benton Health Equity Alliance that Dev Northwest currently administers. This is an alliance of more than 300 individuals who are working on upstream public health solutions, on public policy, environmental change, so everybody in our community can be healthy. Dev Northwest took on the administration a year after Benton County helped start it up. And we've taken it on for the past 12 years or so. Sorry, I just recently left Dev Northwest, and I've been there for 36% of my life. So I'm gonna say we because it's a huge part of me still. And I'm transitioning to a new role in government shortly. So Benton County Health Department was able to secure a grant by Robert Wood Johnson Foundation many moons ago. And we collectively worked in targeting our time and energy in South Corvallis and Monroe. The work that public health can't be done alone, and it can't be done in a silo. We all know that. And so we were able to work with the school districts, government, businesses, and most importantly, the residents. And South Corvallis is near and dear to my heart. It's a place that I actually live. And we were collectively able to help transform the lowest neighborhood, school, and park into a much more vibrant area. So a park got to be able to revitalize because residents came forward and wanted change. We're able to work in partnership with Benton County Health Department to be able to have more amenities at our local park, where kiddos are now accessing outside and able to play on better equipment. And prior to that, there was very little. Just recently, after years of advocacy and work with the community, now there's a path from Southtown to downtown in Corvallis, which is phenomenal. There's been fatalities on I-99 multiple times, and it is not safe for people to walk or bike from downtown to Southtown. And so it's great to have access to a safer path. And the community is looking at having a comprehensive corridor study in South Corvallis for years to come, so that hopefully we can slow down the speeds even further. The community has, Benton County Health Department has really helped transform how Dev Northwest looks at our design of property. So they're a community development corporation and own over 400 units of affordable housing in Lynn, Benton, Lane County. And through our partnerships with Benton County, we're able to really look at how do we design future affordable housing developments? How do we have a healthy communities lens so that we're helping not only to develop affordable housing, but making sure our residents are building community, have green space, have access to all the things we all need, including healthcare and food and resources. We designed a property in Southtown that didn't have the parking right next to the units. And we got pushback from funders. They said, you can't do that because you won't be able to rent that affordable housing unit. And we pushed back a little bit after talking to our friends at the health department and said, actually, we're trying to build community. We're trying to build a place where people will have both green space, kiddos will be able to play, and folks will be able to be forced into engaging with their residents. This is one of the most vibrant communities that we have in South Corvallis, and the design actually worked out and our funders finally agreed. We made all of our properties tobacco free years ago. I was so resistant and scared and reluctant to do such a thing because my mom grew up smoking. I grew up in a household of smoking, and I know what it's like when people quit smoking. And I was worried that we would be inflicting some sort of harm on our residents. And the opposite was true. Our residents came forward and thanked us for helping them make the decision to finally quit. We don't allow properties to have any smoking, and our residents, many of our residents actually came forward and have quit because of our policies years ago. We now have community gardens, we have health navigators, we have the resources to help our residents not only access care, but we're working on upstream solutions to keep people healthy in the first place. Denver Northwest, or formerly Willamette Neighborhood Housing Services, is recognized nationally for our health and housing policies, and we wouldn't have that recognition without the health department. They help teach us how to work in collaboration, how to break down silos, and how to really work on solutions so everybody in our community can be healthy. COVID hit, and because of our partnerships with the health department, we're on speed dial with everybody. So we were able to get PPE to our residents and masks as quickly as possible. We were able to reach out to the health department to make sure that we were getting and operating a safe food distribution center at one of our properties. And I can't thank them enough. They've taught me professionally so much. They've helped our residents be healthy, and we're working on much greater solutions so that we're keeping people healthy in the first place. And trust and collaboration means the world. So with that, thank you.
All right, thank you so much, Brigitta, and welcome to your new world in government. I feel like we should insert an evil laugh, but in all seriousness, it'll be great to have you on sort of more closely on our side. Next we have up, it's my understanding, we have a pinch hitter for Pat. But before we go to that, we have Bridget on deck. Is Bridget, are you available? And if so, please unmute yourself so we know that you are with us.
Yes, I'm here and enjoying this gathering. Thank you.
Excellent, thanks. We'll see you in just a couple of minutes, but if I could now turn it over to who's ever pinch hitting for Pat, unless Pat has joined.
Hey, this is Eva Ripito. I'm with AFSCME Council 75. I'm political coordinator. I've known Pat in this capacity for a while. Apologies for pinch hitting for him. But Pat has, I believe, been with Lane County since 1988. And when I ask what his position is currently versus normal times, he said that during normal times, he's the vaccine coordinator for Lane County, so would likely be able to underline a lot of what Jocelyn said earlier. And during COVID, he has been overseeing the stores and PPE distribution. Prior to that, he was overseeing and monitoring the $1.75 million of vaccines used by Lane County's 6 clinics. And since March of this year, he's been working in the Emergency Operations Center responsible for the supply of PPE in the county for doctors, clinics, first responders, and others. And is currently transitioning back to vaccine distribution and clinic management for the COVID vaccine. And he's served in many leadership roles in AFSCME at his local and at the council statewide level. Public health is people powered. Like Brigitta said, public health adjacent. I have privilege of working for an organization that represents many who do local public health work on the front lines. And in that capacity, I've been able to be on the Public Health Advisory Board with Muriel and others, and learned a lot about public health over the last few years. And one of the things that I know, it's very people intense. It's for people, by people. And we really have had our public health workers wearing multiple hats, working across programs for years and doing what they can with what they have. And while they've been asked to be fluid in their roles and their work and their approaches to preparing for emergencies and responding to the needs of their communities, the majority of the funding has not been fluid and followed where the work has gone, and because it's tied to specific programs. So modernization is about building long-term resiliency in the system. And to do that, we must invest in resiliency in the workforce. As mentioned before, public health workers prepare and respond to the needs of the communities with the communities, with our communities. And to do this, we have often taken multiple roles, and experience and expertise are needed to be successful in keeping all in Oregon safe and well. We have long been stretched to the limits, and the last 10 months of COVID response have taken a toll on the workforce. There are many in public health who have retired or are thinking of retiring earlier than planned because of the nonstop work in response to COVID, along with the continuing public health needs. And it's really worn on the workforce. I mean, many of you are feeling that, and my heart goes out to all of you every day. To build, those far from retirement wonder how long they can hang on to the pace too. To build a fully modern public health system and have long-term sustainability, we'll need to have investments that support and rebuild the workforce. We need enough people to do the work, and we need to keep people who have worked through this response, as well as our wildfire responses, H1N1, and the average run-of-the-mill public health work. We've been making it work on the shoestring budget and asking partners to step up who have even less. Please know that those in the field know that we can't be successful in public health work without our community partners. If we are able to tackle the public health crisis of systemic racism, we have to have a system that gives us all the resources we need and not further pit us against each other in fighting over the small investments made. Team efforts need team-sized investments. I am really proud to be able to pinch hit for Pat and to help carry forward the message of public health and for the frontline workforce. And I'm really proud of all the work that you all have been doing out in the field. And so I thank you all for the partnerships, and I look forward to continuing the work and getting our public health system modernized and fully funded.
Thank you very much, Eva. Thanks for stepping in for Pat. Next, we have Bridget Cook, the co-founder and executive director. And Bridget, would you mind helping me out with the name of your organization, just so I don't mangle it?
Sure. Yeah, it's Adelante Mujeres.
Adelante Mujeres, thank you. And Adelante Mujeres is located in Washington County. Bridget has worked in the nonprofit sector for over 25 years. She works to provide programs for immigrant women and families that address key obstacles to justice and promote respect and dignity for all. And before I hand it off to Bridget, Eric, you are on deck. Are you here? And if you could you confirm, please, that you'll be ready to go?
Yes, I am here.
Okay, great. Bridget, the virtual floor is yours.
Great, thank you. I don't need to get that phone that's ringing, so we'll just ignore it. Good morning, everyone. I really enjoyed being here this morning. It's so good to learn about public health modernization. That's not my field, so this has been an education for me, as well as to listen to the other panelists about how the public health departments throughout our state are working in the community to further well-being and address disparities. So Washington County in general is an extremely important partner for Adelante Mujeres. And regarding our work with the health department, there's so much that I could say about the ways that we partner, but I'll just mention a few of the ways and then I'll share a couple of stories. First, just a little bit more about Adelante Mujeres. Two Spanish words roughly translate as women rise up or women move forward. We started Adelante Mujeres 18 years ago to respond to both the needs of the Latinx community, but also the tremendous potential. We work to build a more just society by empowering Latinas to lead, and we reach about 9,000 individuals a year through 12 different programs. So there are at least 4 specific ways the public health department is super critical to our work of reducing inequities and disparities. And first, the health department supports our Nourish the Community initiative to address racial and gender disparities and improve health outcomes and general well-being for the Latinx community. And I'll come back to this one. Second, in partnership with our empresas or microenterprise small business program, the health department's environmental health and safety team has just been invaluable in teaching our entrepreneurs about food safety, including obtaining a food handler's card and then helping them to understand the various food-based licenses, which ones they need, and how to prepare for inspections. And one of the great outcomes of this partnership has been that those inspectors are really seen not as boogeymen, but as coaches and advisors to help them improve their business practices. And since starting a business is a really viable pathway out of poverty, and it also gives immigrants a wonderful way to become part of the community and to know that they are giving back to the community. Having this partnership with the county is really essential for the success of those businesses. The third partnership I want to briefly mention is with our Adelante's Chicas Youth Development Program. And through this program, we reach over 700 girls in Washington County in partnership as well with the school districts. And we're addressing social determinants of health by providing Latino girls with tools and opportunities so that they can dream big and set inspiring goals for their lives. Because when the girls are jazzed about what lies ahead of them, then they are much less attracted to risky behaviors. They keep their eyes on the prize of a positive future. And our partnership with the health department makes just numerous opportunities for these girls possible. And then lastly, the county's engagement with us and other CBOs in the county regarding COVID has been just fundamental to our ability to educate and comfort and console the community around the pandemic. So I want to go back to the first one that I mentioned, our Nourish the Community initiative, about this partnership that is via the CHIP resources. So one aspect of this initiative is developing community health workers among the Latinx community. So we launched our first Promotoras de Salud, our health promoters cohort, this past June. And these 12 participants at this time are Latinx community members who want to be peer leaders and advisors in their community. We've divided their learning into quarters. And so this past summer, there was a real focus on SNAP access, especially related to the CARES Act, through outreach, education, and navigation that the promotores took part in. In the fall, there was a real focus on the flu shot campaign and learning about the importance of vaccination and promoting vaccinations within their unique settings. And then this winter, we'll be focusing on mental health, mental and emotional health campaign with those promotores. So there's just incredible diversity among this group, but I would say that they all agree that their involvement truly gives them a sense of purpose, and it helps to satisfy both their desire to grow as individuals, as well as their interest in being a support to others. One participant named Elvira has been involved with a number of Adelante's programs, from our adult education program to leadership programs, and now she's one of the promotores. And she organized and now leads a food pantry in the middle school in Forest Grove. Elvira she's one of those quiet, unassuming leaders who shows the way by example and by invitation. And so she has attracted a number of new volunteers to this effort through her enthusiasm and her commitment. She uses the encounters with the community at the food bank to share all sorts of information about health, as well as other ways the community or these individuals can access support and be engaged in the community. So she's just that kind of leader who soaks up knowledge and then passes it on in a very non-judgmental way, and has that real multiplier effect that the county makes possible. Also want to just tell you briefly about Rosario. She's sort of the opposite of Elvira, in that she's unafraid of speaking up and calling out what's not working. She also brings in others who may be more timid and assures that their voices are heard as well. So she, this summer, became the real community go-to person around SNAP education, which was just so critical given the disparate impact of COVID on our community. Rosario is also the mother of a child with special needs and sees her primary calling as helping other families access the support they need through school districts and elsewhere, and just find their way through very complicated systems. These are just two examples that really point to how the county support is bringing folks together to address real needs. And it also creates a community of peers among immigrant Latinx members who, as they're learning it together and then giving back together. Recently, Rosario shared that her involvement, more than anything else, is what gives her energy and hope. And it gives her purpose, knowing that while she and her family need support because their child has special needs, she can also, as a newcomer and an immigrant to the community, really help others by passing on what she's learning. That, she says, is really what keeps her going. So thank you for having me, for inviting me to this gathering, and really thanks to all the Washington County Public Health Department workers and leaders and the work that they're doing with us. And these partnerships are so critical to furthering justice through public health initiatives.
Thank you so much, Bridget. Next up, we have the Executive Director of the Eugene Springfield NAACP, Eric Richardson. And I do want to, those who have been in meetings with me know I'm a little bit of a stickler on time. We are supposed to end at 11:30. We have built in a little time for questions, although it will probably be very, very little time. So perhaps we can stick up in the chat or somewhere a spot that people could direct questions to in case we don't have time to get to very many questions. But we do want to definitely get to all our speakers. So Eric's up next, but Taylor, you are on deck. If you could unmute yourself, Taylor, and let me know that you're here before we get to Eric.
Yes, I'm here. Can you hear me?
I can. All right, so you go ahead and mute, and Eric, you have the field.
All right, thank you very much. My name's Eric Richardson. As you can see there, I'm Executive Director here in Eugene and Lane County. Basically, I represent the NAACP, and I'm sure most of you know about the NAACP, but I like to just talk about it a little bit. We are an organization that is 112 years old, and we've been committed for that whole time to trying to build a healthy mentality for our nation that will inform the policies and the behavior of our leaders and our people to make the decisions that we need to make on policy and on practice going forward. And so yesterday in our nation, we see that this idea of equality and equity amongst people is not, we haven't got there yet. Some folks feel like this nation and its resources are meant to be directed towards certain spaces. And I think when we talk about modernization, we're talking about the modernization of our thoughts and our processes as a nation. And we have to acknowledge that it hasn't been long, and we are still in the process of modernizing our thoughts around racial equity, around economic equity and access. And so public health is something that we fully support, but we also know that there are detractors. And we want to say that public health is social health. And anyway, to build equity calls for reversing years of underdevelopment and neglect. And we see a lot of the efforts that are coming about through this process is moving in the correct direction, building the idea of collective impact, of bringing people together, bringing skills, resources, and connections and access, points of access together, and aligning our efforts and our resources. And we've seen positive results, especially this year in the middle of a pandemic. I just really happy that we have been able to build trust amongst an organization such as the NAACP, which is a known organization in the Black community. It's a known national organization, but there's a lack of understanding our trust in place. And so we are working diligently to build trust between CBOs such as the NAACP and organizations that represent the African American Black community that have been underserved and underutilized. We would like to build our capacity, and through trust and through collaborative efforts, we will be able to help our community by building capacity in our organizations and through collaborative efforts. And so I just want to thank all of the people, Lane County especially, but we've also worked with Peace Health Medical Group, with the AARP, with the HRD Alliance, with the Food for Lane County, understanding that we are serving many of the same people. If you're looking at the ALICE indicators, if you're looking at other words, so why have different plans of attack when we all are trying to do the same thing, and we all want to build unity and brotherhood, sisterhood, neighborly relations going forward. And I think it's very important, this effort, this idea of public health really emphasizes that people are the public, and those who are the most needy are the ones who we as servants and leaders have an obligation to lift up as best we can. And I think that the NAACP really cares deeply about the soul of our nation, and health and one's livelihood and day-to-day health is related to how our soul is doing as a nation. Anyway, I don't want to get all into that, but I just want to say thank you for that. There's a lot to talk about. We appreciate the idea that investment in responsiveness and getting it to the street and to the people who need it most. And we're just looking at the idea of historically disadvantaged people. And those are poor people, they're rural people, people of all complexions. And we want to make sure that as we go forward, the modernization is looking at that historic disadvantage that people have had, and we are trying to modernize our thinking, our processes, and our intentions. So I just really look forward to doing that with you all together and continuing to serve our community. We've had with Lane County Public Health at least two direct COVID testing events for the African American community where we were able to test over 60 people. We are working currently with Lane County Public Health for the wraparound services for COVID response. And we are seeing the gratitude of the community for such programs being set up and going forward. That is going to build trust and involvement from communities who in the past may not have been as involved. But so thank you all for this and appreciate the time.
Eric, thanks for those thoughtful remarks and presentation. Next up, we have Taylor Pinsent, the Senior Communicable Disease Epidemiologist for the Multnomah County Health Department in Portland. Between her time in Colorado and Oregon, Taylor's been working in county public health for over 15 years. She has a Bachelor of Science in Environmental Health and a Master's of Public Health in Community Health. She is going to wrap up our community presentations by sharing how the Metro Region's modernization investment supports engagement with community. Taylor?
Great, thank you. Can you hear me okay? Great, I always get worried about muting. So hi everyone, thank you again for creating this space for me to share our story. Like shared, my name is Taylor and my pronouns are she, her, hers. And I just wanted to quickly start by thank you, Eric, first of all, for acknowledging the events that have occurred over the last few days. And I wanted to take some of my time of my allocated time to just kind of acknowledge what's happening in our country and hold space for these events that have impacted us each differently. That is one thing I've taken away from all of my community meetings, is that there's always this space created to acknowledge that we are all coming together from different lived experiences and reactions to what's going on in our country. And then thank you, Eva, for your words. They really resonated with me as well. We're all tired and we're all working multiple jobs underwater. So thank you for those kind words. So today I'm excited to share a regional story. This includes some of our public health modernization work that included Clackamas County, Yamhill County, Washington, and Multnomah County. I'm going to highlight how the investment in the public health modernization efforts has been used over the last few years. I'm currently coordinating and contributing often, as we often do in local public health, we wear multiple hats to this modernization effort. As an epidemiologist, my job is to understand how diseases, specifically acute diseases, impact our communities using data and using science. So I'm here to highlight how these investments prepared kind of the most populous part of our state for this pandemic. For a little bit of background, when I use the phrase data mart, and I presented something similar to this, I think similar group before, but basically what we created with some of this funding is what we call a regional data mart. So what that means is that communicable disease data that is collected by local public health authorities is all fed into a statewide system. This statewide system is how we acknowledge or understand and track spread of communicable diseases throughout our communities. So this is kind of the hub of our data. This data system is often difficult to get data out of. And so what we created was a way to get an export of that data daily so that we are directly linked into the valuable data that we collect every single day from local public health to make our data-driven decisions. So again, when you hear me say data mart, that basically means a whole lot of communicable disease data located in one place by jurisdiction that we are able to harness for different efforts. I have to highlight how powerful our data access and this data mart has been for our COVID response. In all transparency, I thought it was going to be a Hep A outbreak or a measles outbreak. I did not anticipate a novel coronavirus disease. While other jurisdictions were battling and wasting time trying to export data each day from our large state system, our team in our region was directly linked into the data. This not only allowed us to develop and post a regional public-facing data dashboard by the end of March, it also allowed us to harness the data for several additional projects. This includes developing a regional case investigation tool that quickly maps and locates common work sites for outbreak detection. This tool allowed our virtual case investigators to make links quickly for timely outbreak or cluster investigations, specifically for COVID-19. This directly impacts our communities. We have been providing data files to the region as we worked to get them access to our raw data. They gained access in September. We are working on developing additional regional tools and continue to provide data QA back to Oregon Health Authority. Informatics, that is the science of processing data for storage and retrieval, or information science, is in fact very progressive and modern and has been our focus these last few years. So how does this translate to equity work? What do we mean when we say we lead with race or we do things in an equitable way? Well, we start by adjusting the power dynamics that some of our systems are built on. How do we do that? We bring more people to the table and we listen. Having meaningful data is only one piece of the puzzle that we often have to put together. The other extremely important piece is the community narrative. From a community engagement perspective, public health modernization funds have allowed us to coordinate at a regional level to develop guidance around how and what we share with community-based organizations for rapid community response. It's also supported rapid community connection and voice to discuss the data. That community narrative was included in our public-facing dashboards. In fact, we had several data town halls to discuss our case data, specifically around COVID-19, with the community. We shared what we had with the data, but we also wanted to listen. As our case counts across the region surged, it was even more important that we connected with our community-based organizations and community partners to include the narrative into our data interpretation. We were completely overwhelmed with the cases. A notable example of this is how we visually displayed our race and ethnicity data specifically for our region. A narrative written by community partners with public health highlighted how this virus, COVID-19 or the SARS-CoV-2 virus, impacts groups differently based on categories that reflect an inequitable distribution of risk of being exposed to COVID-19 and the opportunities to access medical care and COVID-19 testing. I want to take a moment to just acknowledge my privilege of being able to work remotely and also order groceries, not having to leave my house to go to work. We are working hard to make sure that these efforts are sustainable and that this great work continues. And I know from listening today, there are specific outcome measures and metrics that mean a lot to folks, and that means you have data. And I want to highlight that this work not only involved our community partners and public health, but it also involved our IT colleagues. So IT is not just the help desk when you can't log in or you forget your password. We need IT infrastructure to harness our data and capture our important work so we can understand those metrics and we can collect data around community to make those decisions. There is no data without IT infrastructure. Thanks.
Taylor, thank you very much. And thanks to everyone who shared their stories from the field. You know, public health really is people powered, and these stories show the power of the people and local community relationships. Not all of these community stories were specifically about public health modernization, but they do show the absolutely vital role that public health plays in communities throughout Oregon. So, as we look and prepare for the 21 legislative session, there are many takeaways from the COVID-19 pandemic. A couple of those for me is that public health is absolutely essential. We must build up our state, local, and community-based public health system when we're not in a pandemic, so we'll always be prepared. Another major takeaway is that we need to lead with a health equity lens, focus on eliminating health disparities in all the work we are doing. As you have heard from community and healthcare partners, the partnership in communities across Oregon is essential, which leads us to public health modernization, which is an opportunity to invest in governmental public health, lead with equity, and fund partnerships with community-based organizations. This is the time to make these investments. County commissioners, in partnership with AFSCME, CLHO, and other partners, are asking the Oregon legislature to invest $68.9 million into Oregon's public health systems, tribes, and community-based organizations. These investments would make progress in the communicable disease and environmental health program areas using an equity and community partnerships lens. Just examples of what this investment would allow: continue building a modern communicable disease response system across the state that can work across county borders, protect communities from acute and communicable diseases through prevention initiatives that directly address health inequities, and mitigate impacts of climate change on public health with a focus on health inequities that are intensified by climate change, and continue to be accountable by using accountability metrics. As we started on this journey to modernize our public health system in 2013, the vision was to implement the Public Health Modernization framework outlined in law by 2023. We heard that Oregon is still on this path, even though it's taken longer than we thought to make progress on implementing this vision. This bill, this session, one of our bills will be to change the date of requiring implementation plans from 2023 to 2025, allowing the systems to take more time to implement the framework as outlined in law. And now, I know we only have a few minutes left, but Marlene, could you open the chat function, please? And I'm going to hand off to Commissioner Minty Morris and see if she can field the questions and see who can answer, if you don't mind, Commissioner.
I am happy to do that. I think just based on timing, I will have our great facilitators help us out with this as well if something comes up. But because we are tight on time, I think if we can just keep it to 1 or 2 questions, if we have something that comes up. One thing I would note is that all our presenters, and of course, Commissioner Hall and I, Morgan from CLHO, Lizzie from AOC, we're all very accessible. So even if you don't have something that comes to you right now, or we don't get an opportunity to get to it, please do reach out to any and all of us. We will all do our best to help you out. We've all taken in a lot of information over the last 90 minutes or so, all really great information, a lot to process. So if we don't end up having any questions right now, that's okay too. Sorry that I'm a little clunky with my doing this all on my phone. I haven't seen any questions yet, and since we are getting near the time, I think I might just use the privilege of being the co-moderator to go ahead and just say thank you to everyone for joining us. Again, please, if you have a question for one of the presenters, do get a hold of Morgan, myself, Commissioner Hall, the presenters directly, because I know that everybody, the whole purpose of us being here is that we're all really passionate about public health and of course, public health modernization. And we have a lot to do once the new session starts to get support for that. We should all be able to share the slides that we have here today. So we will be able to give you access to that. Thank you for putting that in the chat. And with that, I hope everyone has a really lovely rest of your Thursday. In terms of where we can find the slides and recording, maybe Morgan, if you can unmute yourself or stick up in the chat, or Marlene, is there a way we can email that to the list of participants, or how can we get that out?
I'm going to look to Eva, who's been doing all of the great Zoom logistical support.
Thank you, Morgan. Marlene's the magical person who has done the tech support behind the scenes, and we will be able to put the slides and the presentation in a Google folder that we can share the link to with everybody who had registered for the town hall, if you all are interested in that.
Great, and we did get one question to as we wrap up from my friend and colleague Commissioner Darrow from Harney County, a question about whether having local control over the public health modernization was going to be part of the conversation, and I don't know who would be best to field that question. I know that that's probably a big piece to a lot of local health departments. Does anyone want to jump in and take on that piece of what will be the emphasis on local control in public health modernization?
Sure, this is Morgan Cowling with the Coalition of Local Health Officials. I will attempt that question. As Muriel laid out kind of the phasing of public health modernization, there are several programs within public health modernization. We're kind of in this phase 1 to phase 2, which is communicable disease to environmental health. And I think the idea with public health modernization, as you heard from some of the examples, is to give communities the ability to invest in, in eliminating health inequities based on the data of that local community within that program area. So there is some flexibility, but there isn't. We still want to make sure that we're moving in the phase in those specific program areas. So that's why many of the examples really are focused on communicable disease and examples from local communities, because that's where the investments have been thus far.
Great, thank you so much, Morgan, and thank you to Patty for the question. And so with that, we're at our time. Thank you to all our presenters for your really thoughtful comments, and for what a wealth of information we had on this call. Thank you to Commissioner Hall for co-moderating, and everybody have a lovely rest of your day.